Hi everyone, I'm with Dr. Rahul Baxi, a diabetologist at Bombay Hospital in Mumbai. I am Namita Jain, a wellness specialist and a wellness author, and I would love to understand, the subject on insulin with type 2 diabetic patients. There are a lot of myths floating around and a lot of confusion in the minds of people is, can we not take insulin shots, and what happens if we stop? So, in your opinion, what do you have to say about so many of these myths floating around
Yes,
with
this is a
regards
very
to
important
insulin?
topic, and good that you brought up this
Yes.
question. So, first of all, let me mention, if you have type 1 diabetes, insulin is the treatment. You cannot stop insulin. This is one thing what I want to mention at the start. Now, talking about type 2 diabetes, that's where the myths come along, because there are so many ideas, so many thoughts, so many advertisements going on sometimes, by some other practitioners of different types of medicine, that insulin may not be safe. So, let's talk about a few myths here. First myth, what is floating around is insulin can damage your kidneys. So there is no truth in this. In fact, insulin is a very good drug. In fact, if your kidneys are damaged due to any reason, you have diabetic nephropathy, insulin is the only safe drug which I can give. So it does not harm your kidney. In fact, controlling your sugars will protect your kidney. Another myth which patients come to think of is that, doctor, if you start me on insulin, I may not be able to stop insulin ever. Means it is for lifelong. So
Right.
there's some patients may require insulin for a long period of time. Some patients may require it lifelong also in type 2 diabetes. But
Right.
there is a good subset of patients where,
Right.
with appropriate diet,
Right.
appropriate exercise, and
Yes.
giving insulin at the right time in the right way, I
Right.
may be able to stop insulin after some time, after controlling the sugar levels. So when patients require it for longer period is when patients tend to delay. Doctor,
Right.
let me try my diet this time. Doctor, it was Deepavali or it was a
Right.
festival, and
Right.
let me try it. Give me 3 months and I'll come back again. When you delay, and when there is organ damage, you affect your eyes or kidney or heart. That is when I start insulin, I may not be able to stop it. So appropriate timing is very important.
Right.
Some patients will be scared that, oh doctor, how will I inject? Nowadays, we have very sophisticated pen devices available, which
Right.
even young children can inject themselves.
Right.
We train them. We have training facilities. When we
Right.
train even younger kids also how to inject, the needles are very, very small. They're almost
Right.
painless. So these are
Right.
some of the myths which we want to create more awareness, so
Yes.
that, when your doctor offers you insulin, when
Yes.
talks about insulin, be open to it,
Yes.
understand, its
Yes.
indications, question your doctor, ask them,
Yes.
the doctor,
Yes.
for how long it is, what's your plan, and so on. And then make an informed decision, which will be important to control your diabetes.
So for type 2 diabetes, rather than say no to when your doctor is advising you to take insulin, please question your doctor, like you said, because there are a lot of myths floating around which may not be true. So it is very important to get proper advice from a doctor before embarking on this journey for treatment.
Absolutely.
Yeah. Thank you so much, doctor, for this very useful information.
Thank you.